Hello. At Mahold, we have gotten a lot of questions from clients regarding the coronavirus/COVID-19 pandemic, and we wanted to take an opportunity to give you some straight answers. The most frequent question we've received is, does my policy provide coverage for lost business income due to this pandemic? The short answer in almost every case is no. Business income is part of your property policy, and business income coverage is triggered by a covered loss to your property. This means that in most cases, your property needs to suffer physical damage before you'd be eligible for a business income loss. This pandemic poses a health risk and not a property risk. Additionally, most insurance policies further clarify their coverage by specifically excluding quarantinable diseases or contaminants. Another question we've been asked is, if my employees contract the coronavirus at work, will they be covered by work comp? Again, the answer here is generally no. It's important to note that each state has different statutes when it comes to work comp coverage. However, in most cases, and including in Minnesota, an employee can only seek work comp benefits for a disease that's incurred as part of their occupation, not what are considered ordinary diseases of life. So the coronavirus is similar to the flu, and employees are exposed to both in and outside of their work. So it is possible that some healthcare employees might be considered to have an occupational exposure to the coronavirus or COVID-19. However, that's going to be a very narrow subset of employees. We've also gotten questions about how health insurance applies to this pandemic. So, because the coronavirus has risen to a level of a significant health concern, Minnesota-based health insurance carriers have implemented coverage with no member cost share for the administration of the COVID-19 diagnostic testing for fully insured health plan members at an office visit or an urgent care facility. All self-insured clients have been contacted by your Mahold team to walk through steps to include the same coverage in your plans as well. Minnesota health insurance carriers have also temporarily changed some of their pharmacy rules when it comes to waiving the early medication refills on 30-day maintenance medications. The health insurers want to make sure that their clients have access to adequate medications, and so they're allowing these early refills. A helpful hint, to help limit the spread of COVID-19, carriers provide coverage for virtual or telehealth services such as Virtuwell, Doctor on Demand, Amwell. These are often more convenient ways to access healthcare from home. When appropriate, employees are always encouraged to access virtual or telehealth. A few other points. The IRS this week released confirmation that any waiver of cost sharing related to testing for COVID-19 will not impact the eligibility for those employees covered under health savings accounts. And when it comes to disability and FMLA benefits, we've gotten some questions on this. For employers that provide disability coverage and have an employee with a confirmed COVID-19 diagnosis, which makes them unable to work, income protection will be provided under those disability policies. When it comes to family medical leave, in order to be eligible for family medical leave, an employee or family member for whom they are caring would need to have medical documentation that certifies the individual's condition as meeting the definition of a serious health condition. Therefore, at this time, a diagnosis without a certification by a doctor of a serious health condition or a quarantine order or a need to self-quarantine due to lowered immunity or even the need to care for a child due to school closures would not qualify. However, the coronavirus situation continues to evolve and change almost daily, and the government is proposing some changes that may impact the handling of these claims. We will do our best to keep you apprised of these changes. Additionally, your company may decide to offer a personal leave policy to address some of these situations. The entire staff here at Mahold is working hard to answer our clients' questions and provide solutions. If you have more questions or need additional detail, please reach out to your Mahold team. We have our own contingency plans in place to ensure that we're able to provide continued client support throughout this pandemic. We are all in this together.